Another powerful insight urologists often share has to do with bladder training. You see, the bladder is not only a physical organ, but also a highly trainable muscle system. Just like your heart or lungs adapt to exercise, your bladder adapts to patterns of use. If you constantly respond to the very first urge to urinate, even when the bladder isn't truly full, over time, the bladder learns to signal urgency earlier and earlier. This creates a cycle where you wake up at night for smaller and smaller amounts of urine. But the reverse is also true. By gradually retraining the bladder during the day, you can extend the intervals between bathroom visits. This doesn't mean ignoring the urge to urinate entirely. That can be unhealthy. But it does mean distinguishing between a small twinge of urgency and the true fullness that really requires emptying. Over weeks, this practice strengthens bladder capacity and reduces unnecessary nighttime signals. For many people, this simple behavioral adjustment can be just as powerful as changing fluid timing. Temperature also plays an important role. Cold environments can increase urinary urgency because lower body temperatures stimulate receptors that trigger urination. That is why so many people notice they urinate more in the winter or when they step into a cool room. Conversely, being slightly warmer helps relax the bladder and calm urgency. So ensuring your bedroom is comfortably warm or avoiding cold drinks in the evening may make a difference. Something as simple as a warm shower before bed can help relax not only your muscles, but also your bladder's tendency to contract. Now let's address the kidneys' role, because this is often overlooked. Your kidneys are highly sensitive to changes in blood pressure and hormone levels. At night, a hormone called vasopressin normally rises, signaling the kidneys to slow urine production. But if vasopressin is disrupted, for example by excess fluid intake, high-salt diets, alcohol, or certain medications, the kidneys keep working at daytime speed. This means your bladder keeps filling. The practical takeaway is this: what you eat and drink in the hours before bed influences whether your kidneys obey that nighttime slowdown or not. Supporting this natural rhythm with smart choices allows vasopressin to do its job and gives you uninterrupted rest. One thing many people ask is, how much water is the right amount overall? Urologists don't prescribe a one-size-fits-all number because hydration needs vary depending on body size, activity, and climate. But there's a reliable marker anyone can use: the color of your urine. Pale yellow usually signals good hydration, while darker urine means you need more water. The goal is steady hydration throughout the day, so that by evening your urine is clear but not excessive and your bladder is calm. Overdrinking in a rush, especially in the evening, creates the opposite effect, overwhelming the system and triggering nighttime trips. There's also a connection between hydration and circulation that deserves attention. When we stand and move during the day, gravity pulls fluid into the legs and feet. This is why some people notice mild swelling in the ankles by evening. The moment you lie down at night, that fluid shifts back into the bloodstream, and your kidneys quickly filter it into urine. This is one of the most common reasons for nocturnal urination. But here's the solution. Take time to elevate your legs for about 30 minutes in the late afternoon or early evening. By doing so, you encourage the body to redistribute fluid earlier while you're still awake, so the kidneys can process it before bedtime. It's a small shift that can dramatically reduce nighttime bladder activity. Another point worth mentioning is that not all thirst is equal. Often, when people feel thirsty late in the evening, it is not true dehydration, but rather a habit response or even a sign of dry air in the bedroom. Instead of reaching for a full glass of water, a few small sips may be enough. Adding a humidifier to the room can also reduce nighttime thirst, keeping you more comfortable without overwhelming the bladder. And here is something you may not expect. Certain foods are naturally hydrating, but do not burden the bladder the way late-night fluids do. Fruits and vegetables with high water content, like cucumbers, melons, or oranges, eaten during the day help you stay hydrated, while also providing electrolytes and fiber that slow water release. That means your hydration is balanced, without the late-night flood of liquid straining the kidneys and bladder. The science, the habits, the strategies, they all point to one truth. Hydration is not just about quenching thirst. It is about aligning with the body's rhythms. Drink at the right times, eat foods that support balance, and create conditions where the bladder stays calm overnight. This is the art of drinking water not just for survival, but for restorative, uninterrupted sleep. There is another factor we often overlook when it comes to waking at night: stress. The bladder is highly sensitive to the nervous system, and when you are tense or anxious, it can misinterpret signals and create a stronger urge to urinate. This is why many people notice they go to the bathroom more often before an important meeting, a medical appointment, or even before bed when the mind is racing. It is not always the amount of urine that drives the urge, but the way your nervous system amplifies the signal. By calming the mind before sleep, through deep breathing, light stretching, or mindfulness exercises, you not only prepare the brain for rest, but also quiet the bladder's unnecessary signals. A relaxed nervous system means a calmer bladder. Caffeine is another subtle disruptor. Many people assume that avoiding coffee in the evening is enough, but the truth is that caffeine lingers in the body for up to 6 hours, sometimes longer depending on age and metabolism. Even a late afternoon cup of tea or a small piece of dark chocolate can stimulate the kidneys and the bladder well into the night. And caffeine is not just a stimulant to the brain, it is a diuretic, meaning it pushes water out of the body faster. For someone trying to avoid nocturnal awakenings, this combination can be particularly troublesome. That is why urologists often advise shifting all caffeine intake to the earlier part of the day, so that by evening the kidneys can settle down and urine production can return to its natural nighttime rhythm. Alcohol deserves special mention as well. Although a small evening drink might feel like it relaxes you, physiologically it does the opposite for your bladder. Alcohol not only irritates the bladder lining, making it more sensitive, but it also disrupts vasopressin, the hormone that tells the kidneys to slow urine production at night. The result is that even a single glass of wine can undo the very system designed to keep you sleeping. For those struggling with nighttime awakenings, reducing or eliminating evening alcohol can be one of the simplest, most effective steps toward better sleep. Now let's touch on pelvic floor health, because it plays an unexpected role in nighttime urination. The pelvic floor muscles are the sling of tissue that support the bladder and help regulate the release of urine. Over time, with age, pregnancy, or inactivity, these muscles can weaken, reducing bladder control and making it harder to hold urine overnight. But here's the hopeful news. These muscles respond to training just like any other muscle. Simple exercises, often called Kegels, performed regularly during the day can strengthen bladder support, reduce urgency, and improve capacity. Over weeks and months, this kind of training pays off, not only by reducing daytime frequency, but also by giving you greater stability through the night. Another overlooked aspect is sleep quality itself. When sleep is deep and restorative, the brain dampens peripheral signals, including those from the bladder. But when sleep is fragmented or shallow, often from stress, sleep apnea, or restless legs, the brain is more likely to wake you at the slightest sensation. In other words, poor sleep can make a normal bladder feel urgent, while healthy sleep can make a sensitive bladder less intrusive. This is why addressing sleep hygiene, keeping a consistent bedtime, darkening the room, limiting screen exposure, indirectly helps reduce nighttime urination. In many cases, the issue is not just how much urine the bladder holds, but whether the brain is calm enough to ignore minor signals and stay asleep. There's also a fascinating connection between salt intake and nighttime urination. Excess dietary salt causes the body to hold onto more water during the day. At night, as the body shifts position and circulation changes, that excess fluid is processed by the kidneys and excreted as urine. Studies have shown that lowering salt intake, especially in the evening meal, significantly reduces the frequency of nighttime bathroom visits. It is not just about how much water you drink, but also about how much sodium you consume, because sodium dictates how your body manages fluid balance. Reducing salty snacks, processed foods, and late-night restaurant meals can quietly but powerfully ease the burden on your kidneys and bladder overnight. Let's bring this together with an image. Imagine your bladder as a calm reservoir at night, resting quietly, held steady by strong muscles, supported by balanced hormones, and untouched by irritants. The water level rises slowly and steadily, not in a rush, and the signals to the brain are soft enough that they do not disturb deep sleep. Now imagine the opposite, an irritated bladder, pressured by excess salt, caffeine, alcohol, stress, and late-night fluids. It fills quickly, contracts more often, and sends urgent signals to wake you. The difference between these two scenarios is not luck. It is the result of daily habits, the timing of hydration, and the choices you make before bedtime. In the end, drinking water wisely is less about restriction and more about rhythm. It is about giving your body what it needs at the right time and easing the burden when your body needs to rest. Morning and midday hydration, balanced food choices, leg elevation, stress relief, and mindful avoidance of stimulants. These create a partnership between you and your bladder. That partnership determines whether your nights are restless or restorative. And when your nights are restorative, your days become more energetic, more focused, and more alive. One often overlooked piece of the puzzle lies in hidden bladder irritants. These are foods and drinks that, while not large in volume, can irritate the bladder lining and create unnecessary urgency. Citrus juices, spicy foods, artificial sweeteners, and even tomato-based dishes can make the bladder more sensitive. For some, just a glass of orange juice at dinner or a late-night bowl of pasta with tomato sauce is enough to trigger multiple awakenings. The bladder is like a sensitive sensor, and when it is irritated, it overreacts to even small amounts of urine. Identifying and minimizing these irritants, especially in the evening, can make the difference between a broken night and a full restorative sleep. Hormonal changes with aging also shape this story. As the body grows older, levels of vasopressin, the antidiuretic hormone that naturally reduces urine output at night, may decline. This is one reason why nighttime urination becomes more common with age. But here's the hopeful truth: lifestyle choices can amplify what hormone production remains. By avoiding alcohol and caffeine in the evening, maintaining steady hydration earlier in the day, and following a consistent sleep routine, you support vasopressin's natural cycle, helping it do its work. Think of it as giving your body's hormonal system a fair chance to protect you overnight. There's also the matter of medications. Diuretics, often prescribed for blood pressure or heart conditions, are designed to remove excess fluid by stimulating the kidneys. When taken late in the day, they can virtually guarantee multiple bathroom trips at night. Urologists often recommend taking these earlier in the day, allowing their effects to wear off by bedtime. Other medications, such as some antidepressants or sedatives, may also influence bladder sensitivity. The key is awareness and partnership with your doctor. Small changes in timing can lead to profound changes in sleep quality. Another powerful tool is what I call strategic sips. Many people assume they must either drink or restrict fluids entirely, but in reality, it is about balance. Instead of a large glass of water before bed, a few measured sips can quench thirst without overwhelming the bladder. Imagine watering a plant. A slow, steady drip nourishes without drowning. Your body works the same way. By spacing hydration throughout the day and tapering gently in the hours before sleep, you maintain comfort without creating overnight urgency. Let's take a moment to imagine the outcome. Picture yourself lying down at night, knowing your bladder is calm, your kidneys are at rest, and your hormones are working in harmony. Instead of jolting awake at 2 or 3 in the morning, you drift through the night in unbroken cycles of deep sleep. You wake up in the morning with clarity, energy, and a sense of renewal. That is not just a luxury, it is a medical necessity. Deep, uninterrupted sleep repairs the brain, strengthens the immune system, balances hormones, and restores muscles. Avoiding nighttime bathroom trips is not just about convenience, it is about giving your body the healing environment it needs to thrive. Now consider the opposite, waking up 2, 3, even 4 times each night. Each time, your brain is pulled out of restorative sleep, your heart rate spikes, your stress hormones rise, and your body misses out on the deep cycles that repair tissue and consolidate memory. Over time, this sleep disruption is not harmless. It contributes to fatigue, poor concentration, metabolic imbalance, and even higher risks of chronic disease. That is why urologists emphasize that controlling nighttime urination is about protecting long-term health, not just convenience. Even posture matters. How you sleep, whether flat on your back, curled on your side, or propped up with pillows, influences how fluid shifts through the body. Some people find that slightly elevating the head and chest reduces bladder urgency because fluid redistributes more gradually. Others benefit from side sleeping, which allows smoother circulation. Experimenting with sleep posture is a small adjustment that can yield big results. We also need to acknowledge the role of circadian rhythm. Your body is not designed to treat every hour equally. During the day, kidneys filter at a higher rate. At night, they are supposed to slow down. But if your circadian rhythm is disrupted, from irregular sleep schedules, late-night screen exposure, or shift work, the kidneys may continue filtering as though it is daytime. The bladder, then, keeps filling. Protecting your circadian rhythm with consistent sleep and wake times, dimmed lights in the evening, and exposure to natural light in the morning reinforces the natural slowdown of urine production at night. Every piece of this puzzle points toward a single principle: alignment. Align your hydration with the body's rhythm. Align your food choices with your bladder's sensitivities. Align your habits with your hormones. And align your sleep with the brain's natural cycles. When these pieces come together, the bladder becomes a quiet partner at night, not a restless intruder. You know that feeling. It's the middle of the night, you're in the middle of a deep dream, and suddenly your bladder jolts you awake. You climb out of bed, shuffle to the bathroom, and by the time you return, you've lost that precious deep sleep. For some people, this happens 2, 3, even 4 times a night. And here's the truth, it's not just annoying, it's silently stealing your health. Broken sleep raises your risk of memory loss, weakens your immune system, increases blood pressure, and even sets the stage for heart disease. But what if I told you that one simple change in how and when you drink water could dramatically cut down those nighttime trips to the bathroom? I've spent decades studying the urinary system, and I can tell you this: most people have been taught to hydrate the wrong way, and tonight I'm going to show you exactly how to drink water, so you stay hydrated, protect your kidneys, and finally, sleep through the night without interruptions. Let's start with the biggest mistake almost everyone makes. We're told, drink 8 glasses of water a day. Okay, it's a good guideline, but what nobody tells you is when you drink those glasses matters as much as how many you drink. Most people drink the bulk of their water in the evening, sometimes right after dinner, sometimes just before bed. And here's the problem. Your bladder is a storage tank, but it's not designed to hold a large surge of fluid all at once. So instead of sleeping peacefully, your bladder fills, stretches, and sends urgent signals to your brain to wake up. But here's the shocking part. It's not just about volume. Your kidneys act like the body's water regulators. They filter waste and balance fluid levels throughout the day. At night, they actually slow down. They go into a rest mode so your body can focus on repair and healing. But when you flood them with water too late in the evening, you force them to stay active. It's like making factory workers pull an overnight shift with no rest. The result? More urine production, more bladder activity, more trips to the bathroom. So what's the solution? It starts with timing. The science shows that your body absorbs water best when it's spread throughout the day, not loaded in one sitting. Think of your hydration like drip irrigation for a plant, steady, consistent, nourishing, rather than dumping a whole bucket at once. That means front-loading your water intake in the first half of the day. A tall glass in the morning rehydrates you after hours of sleep. Another glass mid-morning, one at lunch, one mid-afternoon. By early evening, your cells are already hydrated. Your kidneys are supported and you've built up your reserves. Then comes the key: tapering down as bedtime approaches. Stop drinking large amounts of water 2 to 3 hours before sleep. If you're thirsty, a few small sips are fine, but avoid full glasses. This simple shift gives your bladder time to empty before you lie down, while still keeping your body hydrated. And here is the remarkable thing. Patients who make this change often notice within just days that they wake up less at night, sometimes cutting their bathroom trips in half. But there's another layer to this story that most people overlook. It's not just how much and when you drink, it's what you drink. Caffeinated drinks like tea, coffee, and even dark chocolate in the evening act as diuretics. They push water out of your system faster, filling your bladder at the worst possible time. Alcohol does the same thing, That glass of wine or beer before bed? It's not helping you sleep, it's priming your bladder to wake you up. So if nighttime trips are a problem, avoid caffeine after late afternoon and limit alcohol in the evening. And here's a fascinating twist from the latest research. The temperature of the water you drink may also play a role. Cold water tends to pass through the stomach more quickly, increasing urine output. Room temperature or warm water, on the other hand, moves more slowly, giving your body more time to absorb it into tissues. So sipping warm or room temperature water during the day may not only keep you hydrated, but also reduce the strain on your bladder at night. Now, let's go even deeper. Many people who struggle with nighttime urination, what we call nocturia, actually have an imbalance in salt and water. When you eat a heavy, salty dinner, your body holds onto fluid during the day. But as you lie down at night, your body shifts that stored fluid from your legs back into circulation. Your kidneys suddenly detect the extra volume, and they start producing more urine. That's why people with swollen ankles or varicose veins often wake up multiple times to urinate. The fix? Reduce evening salt intake and elevate your legs for 20 minutes before bed to let excess fluid drain earlier, before you fall asleep. And here's one more trick from urology practice: bladder training. Elevate your legs before sleep. Train your bladder with healthy daytime habits. Do these consistently and you'll not only sleep better, you'll wake up stronger, more rested, and healthier overall. Now imagine this. You close your eyes tonight, your bladder empty, your kidneys calm, your body hydrated but not overloaded. Hours pass. You stay in deep sleep, your brain repairing, your heart resting, your immune system recharging. Morning comes, and instead of exhaustion, you wake up with clarity and strength. That's the gift of learning how to drink water the right way. So don't just drink water. Drink it wisely. Your bladder, your brain, and your future health will thank you. But there's something else I need to share with you, because even if you follow the right timing for drinking water, even if you cut back before bed, there are still two hidden traps that might be sabotaging your sleep. The first trap is what I call the silent fluids. These are foods and drinks that sneak water into your body without you realizing it. Soups, broths, juicy fruits like watermelon or pineapple, these are healthy. But if you consume them late at night, they load your bladder just like a tall glass of water would. I once had a patient who was frustrated because no matter what, he was still getting up 3 times at night. When I asked about his diet, he proudly told me he had switched to healthy late-night snacks like orange slices and vegetable soup. The problem wasn't hydration, it was timing. Once he moved those foods earlier in the day, his nighttime trips dropped dramatically. The second trap is something most people never suspect: medications. Many common prescriptions act as diuretics, meaning they make your body release more water. Blood pressure pills, certain heart medications, and even some herbal supplements can increase urine production. And if you take these in the evening, you're essentially telling your kidneys to stay wide awake all night. Doctors don't always explain this clearly, but timing your medication with your physician's guidance can make a huge difference. Sometimes, simply shifting a pill to the morning can give you back your nights of uninterrupted sleep. But there's an even deeper truth we need to uncover, and it may surprise you. Waking up at night isn't always just a bladder issue. It can be a signal of something else going on in the body. Sleep apnea, for example, is a condition where your breathing stops and starts during the night. Every time this happens, your body produces stress hormones that trigger your bladder to empty, even if it's not full. That's why people with untreated sleep apnea often wake up multiple times needing to urinate. In reality, the problem isn't just the bladder, it's the oxygen flow to the brain. Treat the apnea, and the nighttime trips often disappear. And then there's blood sugar. When glucose levels run high, your kidneys work harder to flush the excess sugar out of your bloodstream. They do this by pulling more water into the urine. The result? More frequent urination, often at night. That is why poorly controlled diabetes and prediabetes often show up first as disrupted sleep from nighttime bathroom trips. This is why understanding hydration isn't just about comfort. It is about uncovering the deeper story your body may be trying to tell you. Now let's pause for a moment and picture something. Imagine yourself lying in bed, drifting into deep sleep, and instead of being yanked awake by urgency, you glide through the night peacefully. Hours pass. Your body heals. Your brain clears toxins. Your hormones reset. When morning light filters in, you open your eyes refreshed, with clarity instead of fatigue. That picture is not just a dream. It has a reality that thousands of patients have achieved by learning how to hydrate correctly. But here is the mini cliffhanger I promised you. What happens if you go too far the other way? If you drink too little water to avoid bathroom trips? The answer might shock you, because the consequences can be just as dangerous. In fact, dehydration itself can increase your nighttime bathroom visits. How? When you don't drink enough during the day, your urine becomes concentrated. This irritates the bladder lining, making it more sensitive. A bladder that should be able to comfortably hold 10 ounces of urine starts sending false alarms at 5 or 6 ounces. You end up waking more often, not less. Dehydration also raises the risk of urinary tract infections and kidney stones, two conditions that can make nighttime urgency unbearable. So you see, the goal isn't drinking less water, it's drinking water smarter. And here's something few people know. The timing of exercise also influences nighttime urination. Physical activity moves fluid out of your tissues and back into circulation, which is good. But if you work out late in the evening, all that extra fluid ends up in your bladder just as you're trying to sleep. Shift your exercise to earlier in the day, and you may notice you stay drier overnight. So now we've uncovered multiple layers: the timing of your water, the hidden fluids in your diet, the impact of medications, the role of sleep apnea and blood sugar, the dangers of underhydrating, and even the influence of exercise. Each of these is a piece of the puzzle. Put them together and you gain control over your nights again. But there's still one more piece we haven't touched: the role of the bladder muscle itself. Over time, the bladder can lose elasticity. It becomes less like a balloon and more like a stiff container. This means it holds less, stretches less, and signals urgency sooner. The good news? Just like any other muscle, your bladder can be trained. Bladder training exercises, pelvic floor strengthening, even mindfulness techniques can retrain the system to hold more comfortably. And when combined with smart hydration, the results are remarkable. Now, you might be wondering, why does the bladder become more sensitive at night in the first place? Part of the reason is that our internal clock, the circadian rhythm, influences kidney function. During the day, your kidneys are more active, filtering more blood and producing more urine. At night, however, the body is designed to slow that process down. This natural slowdown is what allows us to sleep uninterrupted. But when fluid intake is mistimed, for example, drinking large amounts of water, tea, or other fluids within an hour or two before bed, the kidneys don to get the memo to slow down. Instead, they continue producing urine at a higher rate, and the bladder sends urgent signals that wake you up. And here's something fascinating. The bladder is not just a passive container. It is actually wired with stretch receptors that constantly communicate with the brain. When the bladder begins to fill, these receptors send signals up the spinal cord, telling the brain it's time to prepare for release. During the day, that's not usually a problem. But at night, those signals can pull you out of deep sleep, interrupting the most restorative phases of rest. That irritation makes the bladder more jumpy, more likely to spasm and send the wake-up message, even when it's not full. So paradoxically, being dehydrated can actually increase the urge to urinate at night. That's why a urologist would say, "Don't just think about how much water you drink, think about when you drink it." A practical approach is this: front-load your hydration in the morning and early afternoon. When you wake up, your body has gone 6 to 8 hours without water. Rehydrating then helps restore circulation, supports digestion, and gives your kidneys what they need when they're most efficient. Continue drinking steadily through the morning and early afternoon, aiming to spread out sips rather than gulping down large volumes at once. Then, as evening approaches, begin tapering your fluid intake. A gentle rule of thumb is to slow down after dinner. You don't have to cut water out completely. That can leave you thirsty and uncomfortable. But aim for smaller sips and avoid large glasses of fluid within 2 to 3 hours of bedtime. This simple shift helps align your hydration with your body's natural rhythm, reducing nighttime interruptions while still keeping you well hydrated. But hydration isn't just about plain water. What you drink matters just as much as when you drink. Many people enjoy tea or coffee in the late afternoon or evening, but both are diuretics. They stimulate the kidneys to produce more urine. Even herbal teas, depending on the blend, can have a mild diuretic effect. Alcohol is another culprit. A glass of wine or beer before bed not only acts as a diuretic, but also disrupts sleep cycles, doubling the likelihood of waking up multiple times. These hidden diuretics, consumed close to bedtime, are a major reason why people find themselves heading to the bathroom at 2 a.m. Now let's talk about one more overlooked factor: salt. High salt intake during the day causes your body to retain fluid. Later, when you finally lie down at night, that fluid shifts from your tissues back into circulation, and your kidneys start working to excrete it, again filling the bladder just as you're trying to sleep. So moderating salt during the day, especially at dinner, can have a surprisingly big impact on nighttime bathroom trips. Imagine for a moment the difference this could make. Instead of waking up 2 or 3 times groggy and stumbling through the dark, you sleep deeply, uninterrupted, and wake up refreshed. Your brain gets the restorative deep sleep it needs to clear waste and strengthen memory. Your immune system resets. Your body repairs tissue and balances hormones.